tribal community, and the speaking ability or communication is the biggest problem, that I want to communicate something to them, and there the language is the barrier. So I think we have done, taking the village level voodoo practitioner and also the person who delivered the babies in the village level. And these are the people that these women can trust, can rely upon, and taking into that whatever you have suggested, that there should be some sort of a program where there is an awareness program generating into these women that we can do that. And I mean, this is a general problem. Fistula is a very common problem. And out of that, all they lose is their life. I mean, everything in their life they're losing. So faith generation within themselves is the must, And who can help? I know that we can help. You can help, but your language is a barrier. You cannot communicate what you really want to tell them. You have to go through media, one step, two steps, and they will communicate your problem. So incorporate somebody who can translate your language into theirs, and that's where I think you will be successful. Okay, thank you.
Somebody else?
Yeah.
Hi, thank you so much for laying the foundation for research into an area that's most important in my heart and in my work. I have two questions. I know that you said that you constructed your tool and you validated it, and I was just wondering what you drew on to actually construct the interview guide in terms of your content area. And secondly, what was your sense about the role of female circumcision, both in terms of the women's self-identification of their fistula issues, but also in terms of the population, what percent were circumcised?
Thank you, Annie. As far as the construction of the survey instrument, it was mainly based on just research and stuff that I had read while I was here prior to going to Benin, and while I was there, Dr. Rashad also helped me to add a few additional elements to it while I was there. And then as far as the female circumcision, it's actually incredibly progressive and interesting what's going on in Benin. It's at this time not completely outlawed, but incredibly looked down upon, and what they're doing is having the people who are performing those female circumcisions are now being trained to be traditional birth attendants. They're being trained about normal labor, and they're trying to incorporate them actually into the health system. So they're trying to make this whole shift away from those old practices towards, better labor delivery practices. As far as our patients, a number of them did have female circumcision, but I didn't include that as part of my study.
Margaret?
Yes, Lisa, I just wanted to congratulate you on doing a beautiful job, and also on bringing narrative analysis to this room. And I want to just reassure you that you don't have to worry about measurement bias or selection bias in this kind of study that you've done, because you went to the people who actually have experienced this, and you asked them to tell you in their own words what happened, and you did a wonderful job of doing that. Thank you very much.
Thank you.
Dr. Burkett?
Yeah, I can't help but share the interplay I'm having with Dr. Jaffe. He's so impressed with all that you're all doing. He says, well, you ought to develop a big endowment to support these young people in their academic work. And you all know that I am working very hard on trying to do that, trying to raise money. At times people have asked me what I was going to do with the money after I raised it. Now we don't have to ask that question anymore. We have more causes to invest in it than we have money to account for. So you're soon going to hear about Celebrate Montefiore on October 22nd. Fortunately, they're going to honor me again, and there's going to be plenty of chances for all of you to help me in raising those endowment funds. And we got